I am Dr. Ashish Dawalwak at Advanced Aesthetics Med Spa. I'm going to talk about breast augmentation. It's a very commonly sought for procedure, one of the most popular abroad, and its popularity is increasing in India day by day. I'll talk about the risk or complications that one may face during a breast augmentation procedure. The risks are fairly low. However, they are the ones that are mentioned in the literature now on the internet are the follow. Hematoma is a collection of blood in the pocket that has been created for the implant, and it can happen if you cough or you sneeze or blood pressure shoots up, a tiny capillary opens and you can get a blood clot. If it's minor, you don't need to do anything. If it's major, it needs to be evacuated, and hence your surgeon will observe you to look out for it. Second is a seroma. It may not be a clot, but it could be just clear fluid accumulating around the implant, and you can tap that with an ultrasound guided needle and take care of it. Doesn't need a reoperation in most of the times. The wound is expected to heal in around 8 to 10 days, but it may take longer. You may need to have some antibiotic changed in case the wound is taking longer to heal or there's a little wound infection. Wound infections are rare, but if they do happen and they penetrate deep and surround the implant, then the antibiotics don't reach the peri-implant space. In that case, you have to take the implant out, you have to wash the cavity, you can put the implant back in, but if the infection is really severe, then the implant has to stay out till the infection gets under control, and then you can put in another implant in the same pocket. Nipple sensation can be sometimes reduced. You never know from where the nerve sensation to the nipple is going from, and in the incision it can get injured, giving you either temporary or permanent small area of numbness in the nipple. Mostly it recovers, but it can stay numb, and it's hard to predict if it would happen or would not. Body lays down a capsule around the implant, and usually that capsule is a fibrous tissue which encircles the implant, and that capsule in majority of cases is soft and supple and can't feel it, but in some who have a tendency to form very tough scars, that capsule can be felt, which is called as a capsular contracture, or it can even squeeze the implant, causing a deformation. And in case that happens and the breasts start getting misshapen, then that capsule has to be released or removed. So that capsular contraction incidence is less than 5% in the present day generation of implants. There is also a very tiny risk that has been recently noted of lymphoma developing in the capsule of some of the older implants and of some particular type of implants. Incidence is like very low, like 0.0013%, but those lymphomas can be observed if you regularly do a scan. At least once a year scan is recommended with an ultrasound or an MRI, just to make sure no fluid is accumulating around the implant, and if everything is okay, there's nothing to worry.